This podcast is for educational purposes only and does not substitute for professional medical advice. Please consult your doctor or other healthcare professional if you have any concerns regarding your health. Hello, everyone.
Hi, we're back, and it's the month of Father's Day.
Yes,
so
it is.
we have a special topic.
Erectile dysfunction.
Whoop, whoop.
We are starting off strong
with
our series here at Funny Medicine. And I mean, come on, who doesn't want to talk about erectile dysfunction on a Saturday at 10:30 in the morning?
Absolutely, with mimosas, because, we have to drink something. So
It's the brunch drink of choice.
it makes sense. It just makes sense. So that's what we're doing, and we're in Evie's house. Check out the TikToks.
Yeah.
They're pretty damn funny. We just
If
said
we
that
do say
before.
so ourselves.
Yes. So give that a shot. I'm already having way too much fun this morning with just the TikToking.
Yeah, the TikTok was great. We're still getting used to TikTok, so it was really funny trying to figure it out.
It took us
Again, we're looking for the floppy disk here.
Exactly.
Okay, we had a floppy disk moment, but we figured it out. Honestly, Julie, you're like really good at TikTok. I did not know how to do the filters, the music.
Dude, it was just because I click on a lot, and then little by little I've learned that.
I need to do that. I
didn't.
More.
You knew more about the editing and stuff. I thought you can only delete clips, and here you are no, you could edit it. And I'm like, well, shit. Okay.
When our two millennial brains come together, we make it work.
Exactly.
We make it work, people.
Exactly. Oh my God. So yeah. That's that. And so in lieu of Father's Day, we're gonna go ahead and talk about erectile dysfunction. We're still brainstorming about next episode, but it's gonna be around the same, type of vibe. Not erectile dysfunction, but fathers out there. We discovered that people have this new word, and I think it's Gen Zers or whoever are younger, younger than us, right after or whatever.
Mm-hmm.
And it's this really cool word called zaddy.
Zaddy. We cannot say that word without
and not laugh.
No, and without being dirty, sexy.
No.
I'm going to try to do it serious. Hello, happy Zaddy Day. It doesn't sound right.
You can't. And it's just so I heard it by this girl, bless her heart. She's really sweet.
Her heart.
Really sweet, but she's
cute.
She is.
She's adorable.
She is. She's she's little too, so I can't say that she's a golden retriever, but she's a Pomeranian. I think that would work.
Pomeranian.
Yeah, exactly. A little Pomeranian. But anyway, really
she's
nice.
Cute. She's fluffy, cuddly.
I know. She keeps me young, I would say. But whatever. And then she was dating this guy that's several years older than her. And she would call him Zaddy. And I'm like, what?
In front of everyone.
Oh, yeah. Yeah. And the first time I heard it,
at the dinner table.
Yeah. Yeah.
Okay.
And I'm like, I think the first time I heard it, I practically spilled whatever was in my mouth. Because I'm just like, you said what? And then she's like, yeah, because he's older than me or whatever. And that's why he's zaddy.
My zaddy.
And I'm like, okay. But then I went to Urban Dictionary yesterday or the day before or whatever. And Urban Dictionary says that zaddy is a noun used for handsome, fashionable, sexy man with swag. But it doesn't say anything about being older unless you're saying then you go down a line and then it says zaddy can also be used to imply sexual roles, a more dominant position in a relationship, a modernized term for daddy, papi.
Really? There's a papi version?
Well, apparently, yeah. I didn't click on that because we all know what papi is. But
can we say puppies? Hi, puppies.
Exactly.
I mean, a Z. The Z is what gives it the zest.
Exactly. Yeah. So, and then their example is, my zaddy came over last night.
Oh,
and then, or he could be my zaddy All right. And then,
I can't with this.
oh, Zaddy.
Oh, Zaddy. You're so good to me, Zaddy.
So I don't know, I thought
Zaddy.
it was more of a medical term because I'm like, maybe it's because of age, but no, apparently it's more about dominance and having swag, or how like the Gen Zers are now saying Riz. Did you know about Riz?
No.
Apparently that's like the new word. You no longer say swag.
Oh.
You say Riz. That person has
Can you
Riz.
use that in a sentence? Oh, okay.
Like that person has Riz, or like, I don't know, let's say somebody that has fashion.
Is that like if something's like really good, it slaps?
Yeah.
Okay.
Yeah, exactly.
Totally slaps.
That's it.
I cannot take myself seriously when I'm saying these
Oh
things.
no. And it doesn't, I'm still going to say swag. Like I can't, I can't
Is
say
there something
otherwise.
for lit? Because Lord knows I'm still saying
I'm still
litty.
saying lit.
Yeah.
I know that there is. And if there's a Gen Zer out there or somebody younger than us, they're probably screaming on the other side of this right now, telling us.
Comment
just
and please
comment and educate us.
Exactly.
Or,
educate us, because and I'm a pediatrician, so I see a lot of kids.
Yeah, you got to keep up with the terms.
And sometimes the way that they talk to me, I'm in my mind, I am not only listening to you, but I'm trying to decipher what it is that you just told me.
Yeah, because you're like, what? You said what? I mean,
yep.
I will find that for the next episode, because there was like this funny skit of a millennial trying to understand what a Gen Zer was telling them. And they're just like with big blank eyes, like, what did you just tell me? And I feel like that's going to be me soon.
I wonder if Gen Zers use Urban Dictionary like millennials do.
I don't know, but I mean, Zaddy is on Urban Dictionary.
No, everything is on Urban Dictionary. If it's not on Urban Dictionary, does it even exist?
Exactly. That's what I say, But anyway, Evie, do you want a Zaddy in your life?
Listen, girl. The Zaddies are a little complicated, so I don't want any complication in my life, but by all means, if there's a Zaddy out there that's willing to take a girl out to dinner and
feed you pasta and lobster,
a little trip to Cabo, feed me pasta and lobster, I'm down, but don't be creepy.
No.
I'm not going to call you Zaddy.
No, that's not happening.
It's not happening. I'm not going to call you Zaddy.
Yeah.
Maybe like once to joke around, and I'll see how I feel about it.
You better laugh.
But honestly,
and you better laugh.
Just saying the word Zaddy makes me cringe a little bit inside.
Absolutely. Yeah. No. Whatever. So yeah. So we're going to talk about erectile dysfunction today, and Evie did a fantastic job. Also, check out that other TikTok that we posted this morning about looking into ED. And I mean, our For You pages, our like history on our computers is...
My TikTok is just erectile dysfunction. Are you happy in your sexual life?
Yeah.
And, I thank God this is my page. Just in case anyone else sees my For You content. Because
oh my God.
It's really, it's... I just have very detailed.
A floppy dick and an erect dick on my computer since the other day that I was like writing our notes, and just like, okay, this is interesting, but
and what's even more interesting is I know that there's going to be people out there that feel really weird about the fact that we're two women talking about a male situation.
Well, we're kind of like reversing mansplaining.
Yeah, but to be honest, I really feel like erectile dysfunction is not as, hidden as how it used to be. It's not taboo anymore.
And especially not in Miami.
And I'm not talking even for the older men, even for the younger men, because there are some 20-something-year-olds that are using Viagra.
I can't.
And popping it like candy.
That's when I run. Yeah. I'm out. Okay? I'm out. It's like, absolutely not. Like, come on now. But anyway, so yeah, I guess we could go ahead and jump right in.
All right. So I'm just going to start the show off by saying what erectile dysfunction is. There's a lot of different definitions. Okay. But I'm dumbing it down, people. Okay. I'm not a urologist here.
We're going to break it down Barney style for y'all.
Exactly. This is just educational purposes.
Yeah. Oh, we're not diagnosing anyone. I mean, we've made it clear before, but definitely look for a doctor if you think you have anything that she's going to mention now. Just go to an actual
it'll be on our
urologist.
disclaimer at every podcast
Yeah.
episode before we start.
All right.
So erectile dysfunction, it's either, lots of different things. You can't get an erection, you can't keep an erection. There's ejaculatory disorders. Yes, I just used the word ejaculatory. How did that make you feel, Julie?
It makes me feel like painful. Like you can't. It's like you're trying to pop a bottle and it won't pop.
I
right?
feel like people with that word, they're very, like everyone has this thing with the word moist.
Well, you do. I know you do.
I do.
Yeah.
So I feel like this is one of those words, like ejaculation.
Yeah. You immediately at least me. I immediately just go.
I'm so jaded by this. I've literally heard this word so many times that I just say it like, oh, how's your ejaculation going? That's how you talk to a patient.
Yeah.
Have you been able to ejaculate?
Dude, how long
does it take you to
have
ejaculate?
you had to do that with like a mom in the room or whatever?
Yes.
Oh my God. How awkward is that? The poor kid.
Honestly, it's more awkward when it's just me and the kid.
Really?
Yeah. But it's, I'm not saying it's not awkward.
Yeah, it's got to be like a little bit. But
if your kid is having this conversation in front of you, trust me, they've already had the conversation before.
Yeah.
But yeah, you definitely have the kids that don't want to put their pants down in front of mom to get checked. And then there's other kids that, don't want to talk about sex with their parents. And then you have the mom that's trying to be, like
a lot.
Yeah, like the concerned mom, but like the cool mom. And she's like, it's okay. You can talk to the doctor about it, Like tell her how you masturbate.
Oh God.
And the kid is literally dying, and I'm dying too. I'm dying with him. I want to hold his hand, like we can die together.
That's what I was gonna say. If I were there, like listening to this, I'd be like, oh my God, can this stop? Just stop. Just no. Oh my God, poor kid, man.
But then I have the parents that do the more normal thing, which is like, hey, I'm gonna leave the room because I can't. With this.
I think I would.
So,
I have a kid. I have a son. And I think when it comes to that moment, I'm going to be like, I'm just going to be right there. Like,
I know, but you'd be surprised how many parents don't want to leave their kid in the room by themselves with a doctor talking about sex.
Yeah. I mean, different strokes for different folks, I guess. But like me personally, like I would be cringing for my kid, and I would make it then awkward because I feel awkward. And then it's like this whole awkward. No.
Yeah. Anytime that happens to me, though, when I feel like there's like awkwardness in the room, I literally just start talking about sex like if it was breakfast time.
Yeah, that's a good approach.
Just like, hey, okay, when did you start having sex? Okay, are you using protection? When's the last time you got tested?
Right.
But thank God I've never had a problem with a kid telling me I can't get hard.
Okay. My God.
There's actually, I've had the reverse. The kids get hard and they actually have something called priapism, which is that they're hard for way too long.
Oh, geez.
That's painful.
That sounds painful. Yeah. Like, I mean, imagine.
It usually happens with like a typical like population of kids, like sickle cell kids and stuff like that. But I've had it happen before. So I've never had a kid have erectile dysfunction though.
No, hopefully not.
I would be concerned.
Yes.
Obviously, that is definitely something I'd be like, you should see a urologist.
Let me refer you.
Yeah. Let me put a little order in there. Stat order. Please go see them tomorrow if you can.
Absolutely. Okay. So there's that. And so you see, that's the awesome thing about being a pediatrician. Like you see all these things regardless.
Yeah, I see it.
Yeah.
It doesn't, a lot of people say that like, pediatrics is like little adults, and it's not. They're two completely different worlds, but we do see it. Yeah. Yeah. And we actually see a lot of the sex topic. I would love to know how many adults are actually talking to their doctor about sex. Yeah, no. I literally have this conversation about sex at least 10 times a day.
Yeah. No. I highly doubt it unless you're like at a urologist or something specifically that has to do with that region in your body. Yeah. Like I don't see how not. Yeah. I mean, the last time I did was for my OB-GYN appointment, which I would hope that you would talk about sex at that point because I mean, what else are you there for? But yeah, I think that's
But sometimes OB-GYNs don't even talk to you about sex. Like they literally just try to tell you, hey, is everything going okay? You don't have any medical problems. Yeah, that's sex. True. I really feel like the only people that talk about sex are like people that are specialized in sex medicine or sex education.
Right. And who do you think are those people? Like, they have their own, like,
those are psychologists, and they have their own practices. Oh, no, they're like sex experts.
Damn.
Yeah, and they have a plethora of education.
Okay.
Maybe one day I'll just interview someone.
Yeah, I am so interested about that now. Like, you imagine, like, their day-to-day about that? It's like,
that is,
and the things they must know.
Yeah.
Like, the things they must know to do.
Yeah.
And, like,
I'm always learning.
Yeah.
But luckily, I don't have to deal with that. Exactly. Pediatrician. And erectile dysfunction happens as you get older, right? So it's more common as you age. And sometimes it could be due to a loss of libido. Sometimes it might be depending on what kind of medical history you have. Right. So if you're a smoker, if you drink a lot of alcohol, if you're a diabetic, you know, all those things can lead to erectile dysfunction. And there's a lot of people that smoke out there.
Oh, yeah. And drink.
And
do other illicit things.
Yeah, exactly. So it does. But isn't it crazy that I read online that at the age of 40, about, like, there's a statistic that about 40% of men disclose that they have some sort of form of erectile dysfunction.
At the age of 40?
Yep. At the age of 40.
Holy shit. Okay.
That's like,
I'm here thinking
that's like right there.
Yeah, well,
for us.
For sure. But, like, that, I mean, either a lot of them are in denial or they're hiding it, because I was always thinking, like, oh, men in their 40s and even in their 50s, they're still in their prime, you know, this and that. And you're telling me the opposite here. So they're doing a great job of hiding this. Yeah.
They literally, and it can be so many things. It could be they can't get up, they can't stay up, they ejaculate earlier, they can't ejaculate, they can't have an orgasm. I know, with the word, I understand. Let's take a shot for every time I say ejaculate.
Oh my God. We won't make it to the end of this episode. We're only like 15 minutes in, and it's like...
it's a lot.
Yeah. Oh God. Okay. So definitely not in their prime, as I thought. You know, in your 40s, you're probably going down instead of staying up.
I'm dying right now at Julie. Her face right now, Julie's face right now is just like utter shock. Yeah. And I'm about to call Mario and be like, we gotta get to work.
Yeah. I mean, he's also 34 like me, so it's like, you only have 6 years.
Oh my God, for his 40th birthday? What are you going to do? Are you going to give him a penis cake?
Oh my God, that'd be insanely awesome. I should do that. Oh my, we should do like a penis party.
Yeah, like a penis party. And then, it's going down from heel, baby.
Oh my God, what do you call those? Piñata. A penis piñata.
Just whack it. Yeah. Oh my God, I can't.
It'll be like, they're going to think that we're going to have a bachelorette party, and it's my husband's turning 40.
I just want to read the room at Mario's 40th birthday party, because everyone's going to be saying happy birthday and that he's 40, this is new era.
Yeah.
And I'm going to zoom into your face, because all you're going to see is, this is it.
That's it. It's all downhill.
Yeah.
It's all downhill from here. According to our second episode.
Julie sheds a tear. And I'll be there taping it.
Exactly. Oh my God. By that time, well, you never know, because like we're advancing so much now with like AI and chat GPT, whatever the fuck.
Chat GPT.
That's it.
Yeah.
That's it.
Do you know that a lot of people are using chat GPT to diagnose and to seek out treatments. And there was actually, they had chat GPT take a medical board, and it passed like with flying colors.
Of course it did. Oh my God.
I haven't tested it out myself. I would love to ask a question and see if it actually answers a correct question.
Like, I've asked it questions, but you have to be, if you make it too like broad or like one question, it just spews out
all the
massive amount. Yeah, and it keeps asking you questions. So it's like, at least what I've seen on TikTok is like, you gotta...
Our source of information, very reliable.
Big time. That you gotta like make it very specific. Like, okay, I want you to make me this advertisement for X company, but it needs to tailor to people 40 to 50, like whatever type of thing. Like you got to make it specific, and then I'll still ask you questions, and then eventually I'll just give you like whatever it is that you initially were asking for. So I don't know. I haven't tested it out that much, but people like kids and all that, they were using it. You imagine if we had this back then, they were using it for their reports, their essays, all this bunch of stuff.
Stop.
And then schools now have had to like put out there, like it's plagiarism if you use chat GPT. Yeah. You imagine? What? You know how many freaking essays and reports and stuff we had to do? All I can
think about is my high school and how much I hated my economics class.
Yeah.
And I feel like I would have been totally fine with ChatGPT. Where the hell were you?
I know. So I don't know how, but I feel like in one way or another, it's going to make its way into ED one day. Because, you know, it's very important for men. You know, as we'll get into it with their mechanisms and all these things that there is out there to help with that situation.
I was blown away by how much there's out there for erectile dysfunction. So you
imagine if you integrate AI into that?
No, I can't. I cannot.
I mean, I don't know. It's going to be like an Iron Man penis.
Run.
Yeah.
Run. Run away.
It's like you got Jarvis between your
legs. Run away right now. Do not think about it.
But you know they'll run
Just walk away.
You know men will run.
Don't walk.
They'll be like, I can put AI in my penis. Are you kidding?
There are prosthetics.
That's what I'm saying. Yeah. Like it's only a matter of time.
Integrate prosthetics with an AI.
It's gonna happen.
You know what, Julie? We should not talk about this here.
I know. TM.
No, forget TM. I wanna copyright this.
That's what I'm saying. TM.
Oh, TM. Yeah. I thought I said too much info. No.
TMI. No, this whole thing. TM. This was our idea. We're open to discussing like, you know, how we can make this like in production, but this was our idea. So you got to pay us royalties here. TM. You heard it here first. AI penises.
Oh my God. I didn't even see if that's like a thing, but
I know. Okay, so since we were off tangent and we went into AI penises in whatever way, let's get back on topic.
Julie, I just wanna get your feedback on this. Do you know how a man gets an erection? Guys, this is natural reaction right now. We have not.
I'm trying to remember my physio days.
We have not reviewed this
from like more than 10 years ago. So I'm digging deep into that brain and something about parasympathetics.
Oh my God, yes,
like that, right?
Yeah.
So it's like when.
Dude, this is great, Julie. I'm so proud of you.
Thank you. And so it's like, it kind of works like when you're not really controlling it.
Yeah, so parasympathetics get you hard.
Right, it's not like you're blinking or lifting your arm or something. Like you can do it on command.
Yeah.
So this just happens, which is why like it's super funny when guys get like random erections at random public places.
Exactly, because they have no control over this. Exactly. But something stimulated them. What it is,
right?
I don't know. You looked at the pasta. You like the pasta so much, you got an erection from the pasta.
It's gotta be hard, man. No pun intended.
I get with that.
To live like that. That's something as easy as like the wind. Just like makes you be at a point that you can't stand up from where you are right now.
So crazy enough, I was, also under the impression like, yeah, men literally get hard de la nada, like, from nothing, right? But actually, it's like way more complicated than that. And, shout out to all the men that can get hard because this is like a very complicated process. So it's like you need the stimuli, you need the activity, the motivation, the vibe. And if you don't have any of that, that is just like my 3 little words that I just used to describe there. But all of that includes like vasculature, like neurological, so hormonal, blood, psychological, physical. All that. And all of that, tell me how that happens in like one second for a man.
Yeah, I don't know. And it happens insane. And they make it look like it happens so easy. Like it just, like you said, look at pasta.
Yeah. But you dive into their body. There's like so much going on in 2 seconds.
I imagine like, I don't know. Do you remember the movie Osmosis Jones?
Yes.
Okay. I imagine like cells like rushing. It's go time, people. Let's go. Let's get this penis erect.
Well, there's this guy on TikTok actually that he like dresses up as like body parts. I don't know his name,
Really?
and I wish
I gotta see
remembered
that.
because I wish I could tag him because he's so funny.
Oh my
But
God.
he acts as like certain body parts,
I need to
and
see
he
that.
acts as a sperm and like an egg. It's really, really funny, but it's insane how much is actually going on, which is, you know, probably one of the reasons like there's so much that can go wrong, and that's why it's probably so common that men have erectile dysfunction. But
because also like the smallest thing could like throw everything off, like hormones and
anything,
whatever.
Literally, if you don't have the appropriate stimuli, which also is crazy. You know, a lot of people used pornography.
Yeah.
Okay. To stimulate. You know, when a guy and like is going to a sperm bank.
Yeah.
They put him in a room.
Right.
They give him some magazines.
Right.
Some videos.
They specs it off to it.
Yep.
Yeah.
Exactly. But actually, there's been some studies which I was like blown away. I'm not sure. This was not like a double-blinded study. So for those of you that are coming at me with the study, I don't know what kind of study this was, but I read up that because people are so overstimulated by pornography, when they go have like a regular sexual intercourse encounter, it's not enough. It's not stimulating enough. So it's actually associated with higher rates of erectile dysfunction. Isn't that insane?
Damn.
So for all you vanilla men out there, you ain't got no problems.
You're just fine.
You're just fine.
Oh my God.
You will have no problems.
Well, it's kind of like what I've heard of some people. I've never done ecstasy or Molly or whatever, but I've heard that some people refuse to have sex while they're on ecstasy, Molly, like those type of drugs that like make everything feel like extra good.
Extra, yeah.
They avoid having sex while they're on those drugs because they say if you have sex while on that, regular sex sober is going to be nothing.
Very sad.
Exactly. It's going to be like, instead of riding a unicorn, you're just like, you know.
But what's crazy is that people that are on these sort of stimulants, like Molly and all of that, so that's going to trigger your sympathetic system, which actually doesn't let you
really
have an ejaculation. Take a shot.
Cheers.
Cheers to that.
Really?
Yeah. So remember that there's like two parts to our nervous system. Parasympathetic, sympathetic. Sympathetic is fight or flight. It's like that boost, that crazy boost of like adrenaline that you get. And then parasympathetics is like you're more relaxed, or that's how they usually describe it for people that are learning about the differences.
Okay.
So parasympathetics, because you're able to relax, okay, men are able to get more blood flow, into their penis. Okay. Which allows them to get hard. Okay. And then if you are sympathetic, right? Then you're not able to, right? Because it's that fight or flight response.
Okay.
So a lot of people are like, you know, take these sort of drugs and have, or stimulants or anything like that, to have these sort of effects so that they quote unquote last longer.
Oh.
Yeah.
Damn.
Isn't that insane?
That's insane.
Yeah.
That's insane. I mean, there's like so much intricacy to this. And then you look at like anything else, like a movie, porn, or just your significant other, and you think it's nothing. And, you know, it's just bing.
I know.
There it is, you know?
I know.
Type of thing.
It's like, but anyways, back to like our topic that we were like talking about before.
Yeah.
The good thing is
is
that even though this is very common, even though this is very common, there's a shit ton of different treatment options for erectile dysfunction.
Yeah, I remember when I was like a teenager, kid, whatever, La Bombita came out, and that was all over Miami, and it was the biggest deal.
La Bombita is a vacuum device used to pump.
That makes you have like an erection. Yeah,
so basically the main thing is blood flow, right? To the penis. So you get the blood flow into the penis, but you got to keep it there. Right. So if you're not able to keep it there, then that's when you have like these symptoms, and you know, and that again, that can have a lot of things, neurological things, you know, different situations,
a whole bunch of things.
Not the right stimulus, libido, all of those things. But the point is that you can't sustain that blood flow to sustain the erection. Okay. So what were we talking about?
La bombita.
La bombita. Yes.
Yeah,
So la
the
bombita.
vacuum,
Yeah.
aka the
So la
vacuum.
bombita, they literally use a vacuum device to pump, literally to vacuum, okay, blood into the penis. Then they put a ring at the base of the penis, okay?
Ow.
Yeah. Yep. To keep it there.
God, you men go.
But you got 30 minutes, bitch. So you better be fucking ready with the lube.
Oh my God, like you men go through all of this just to get it on.
What women go through, girl. Forget about the men, the women.
Oh no, I know, yeah, for sure. But
honey, the kids are about to wake up. Okay, so make sure you get the vacuum going. Okay, because we only got a certain time window.
Oh my God, yeah.
Tell me that's not. Tell me that's not.
Yeah. You're definitely not using that for a one night stand. Like it's not happening.
100%.
You cannot.
Listen here, all the men out there that are listening to this, do not, okay, use this vacuum device unless you really know the person.
So is it like...
And also, make sure you know what you're doing, okay? Do not vacuum something that you do not know how to vacuum.
Yeah, that sounds very... it could go wrong really quick.
Oh, it can. It can. And I'm sure it has. And I would love to get the opinion of like an emergency medicine doctor.
Oh, yeah.
And see like how many times has this happened.
Yeah, especially here in Miami. Because like, okay, we didn't come up with the word bombita. Like that's literally blasted here in Miami because exactly. And like all the viejitos, all the
La bombita
people,
for everyone that doesn't know Spanish is the pump. Okay.
Yeah, that's it. Like this vacuum pump, that's what they called it here in Miami. It was just their Miami name for it here. And it was everywhere. I remember as I was a kid, like in the Palmetto Expressway, there was a freaking sign on a billboard for that. And it was in Spanish. I was like, this is insane. But anyway, I don't even know. We went off on a tangent and I forgot where I was going with that,
so before La Bombita,
yeah,
it's usually, I think the first line is Viagra, right? Which is sildenafil. There's another name for it, Rotavio or something like that. Yeah, I think Rovatio. I don't know, something like that. Okay. But basically the most common one is Viagra because it lasts the longest.
Or Cialis. Is Cialis one of them too?
Yeah, Cialis is another one.
Okay, there. I'm saying it wrong, but go for it.
Yeah. So basically there's these medications that will, just to go into the science, it's going to increase the nitrous oxide and that's going to help with the blood flow, keep it there, and all of that. So that's why they use this. And actually, funny story, I did not know this. And I forgot who told me this. I'm pretty sure it was one of my attendings, and I think it was my cardiologist.
Okay.
Like my cardiac
it makes sense. I mean, blood flow, the whole thing, yeah.
So this medication, right, Viagra, was actually made for heart patients, like cardiac patients.
I heard a little bit about this. Okay, go into it. Yeah.
So
super interesting.
They got this medication, right? And they were giving it to these people that suffered from cardiac disease, right? And
I heard it was even like older people.
Yeah. Because, the older you get, the more common it is for you to develop cardiac disease.
Right.
So these men, they reported that they were so happy with this medication. And a lot of the doctors were like, oh, well, why? Like, what is it that you like about the medication? And it's like, oh, it makes me last a lot, like my sex life is great now. So they noticed that the adverse effect was an erection.
The side effect,
The side effect, exactly. Not adverse, So side effect of it was getting a hard-on. And that's how Viagra was born.
That's insane.
Yeah.
Can you imagine that pharmaceutical company must have been like,
Isn't it insane?
Yeah. It's incredible. I cannot imagine the people that created that drug in Pfizer, Bayer, whatever it was. Oh, yeah. And when they started realizing that, how they must have just
that's it.
That's
Boom.
It. We did it.
They're like, we did it.
We freaking did it.
I can go retire. Exactly.
Absolutely.
Yeah.
Damn, that's awesome. But anyway, okay, so that was the first line, Viagra, these pills and whatever to get it going.
Exactly. Oh, girl, there's a lot. There's Viagra.
Oh, yeah, just pill forms, though.
Exactly. Those are the pill forms.
You take it by mouth.
Girl, there was penis injections.
Okay, wait, hold on. Okay, so, like a syringe injection, with a needle type of thing.
Yes.
And where does it?
In the penis.
But where in the penis?
I mean, I'm not a urologist.
No, obviously, but the penis, the shaft type of thing?
Yeah, like the shaft, exactly. Maybe like at the base of the penis. I have no idea, but it's going inside the penis.
What the hell?
Yeah, and it's basically like
anywhere
a Viagra,
in the penis, regardless of where it is.
But a local Viagra.
What?
Yeah, which I can understand the benefits of a local.
Yeah, I guess if you have
local
like
injection, so that you don't feel the side effects and other things, like their vision turning blue. Did you know about that?
I'm blue. Da ba dee da ba da da ba dee. Okay, anyway, tangent. Yes. What?
Yeah.
Vision turns blue.
Yeah, they literally have a blue hue to their vision. And it lasts like a few hours.
I wonder why that happens. Like,
yeah,
neurologically, what the hell is it doing in your
effect.
Brain that it's making you like interpret colors like that?
It's like digoxin, the other cardiac med. All these cardiac medications, they all have like these weird things. But digoxin, like turns your eyesight yellow. I'm pretty sure that that's what it is. I haven't reviewed that in a really long time, but I
cannot believe Mario has never told me about this. Like, he tells me about interesting shit out there, like in the medical world. But there's a
famous artist. Oh man. People are going to come at me. The public is going to come at me.
Oh, they're probably screaming at the other side, like screaming the names of these things.
Or Van Gogh. It was Van Gogh.
I love Van Gogh.
Yeah. So like Van Gogh has like a hue of like yellow. So they were saying that he probably had, like he was painting what he was seeing.
Right.
I think.
Right.
Don't come at me.
Yeah. Okay? Don't quote.
Yeah. I'm not quoting anything, but there's definitely a famous artist that they thought that he was on digoxin because of it.
All right.
But anyways, back to that. Yeah. So obviously every medication has like a side effect to it. So I can understand. I know, but an injection. Literally, there's so many men out there that can't get a freaking shot, like a flu shot.
Right.
Okay.
They won't get a flu shot,
so
but
tell me how.
Yeah.
Or tattoos. They can do tattoos.
Right.
Right. But like any injection, they're like, no, hard stop. Can't do it. Not doing it.
Yeah.
And then they're like, oh, but wait. But for my performance, I'm willing to consider it.
Oh boy. Well, I mean, it's,
And just when you didn't think that it was weird with the injections.
Oh God.
There are penile suppositories. Urethral suppositories.
Oh my God.
Guys, we need to start taping these podcasts because Julie's reaction right now is so good.
Well, my mind is blown because like every time at least that I've heard, because of course I'm not a doctor, nurse, whatever, but every time I've heard that a man has to go into surgery or whatever, and then they have to get a catheter in.
Yep.
It's like the worst thing ever.
It's awful.
It's awful, right?
It's awful.
If it's bad for women,
there's people that do it without any like anesthesia.
Yeah, exactly.
Or some type of sedation.
Exactly.
Or local anesthetic.
So how the hell are you going to just at home, stuff a pill in there? Like, and then what? You can't pee then because you're obstructing.
It's crazy when they gave me my epidural totally failed when I was about to give birth.
Really? I didn't know that.
It failed completely. The first time around, it failed completely. And I remember telling the nurses, like, hey, I feel everything. And, they have to put a Foley in. Mm-hmm. So they have to put a catheter. And I told them, I'm like, I feel everything, guys. And they're like, yeah. It just takes a little bit of time to take effect. And I told them, I said, hey, listen, I can lift my feet to a 90-degree, my whole leg is up in the air.
Like, full control.
Full control. And they said, just give it some time. And the nurse was literally prepping me to put my Foley in. And she's like, putting the Foley in, okay?
Oh, Jesus.
And I said, hey, I feel everything.
Oh my God, you're being too nice.
And yes, and I am. You know how I am. I'm like a nice person. I don't like, maybe I should just be a little bit more aggressive. But anyways, I was not aggressive in that moment because I'm having contractions. There's a lot of shit going on.
Yeah.
And this lady fully puts this Foley in me, okay?
Are you serious?
And I felt everything. I literally thought that I would never pee the same ever again in my life.
Yeah. Oh my God. Yeah. Okay, so if it's that bad for us,
I'm literally like dying just to
so I cannot even imagine like how it is then for men. It's all out there. It's this long tube or however, I mean, it depends on your size, whatever. We're not judging that. We're not even talking about that. We're talking about the fact that it has to go in through that track, and it's a thin track. Like,
For my small man, for my big man, for my
and you better
my
be
average
sure
man, it's gonna hurt.
But like, I don't understand how that pill is even exists, because one, putting it in.
Well,
like,
usually suppositories melt, so I'm
Okay.
imagining.
Yeah.
I do not know this.
Yeah,
Again.
yeah.
I've
But, like,
never
in
done
your-
this to a patient.
Your experience of other suppositories.
Yes, with other types of suppositories, usually they do melt
Okay.
right away.
Okay, so hopefully that's the case for
or
this one.
disintegrate at least. I don't
Right.
think that it's something that will just like a foreign body that will just stay there.
Just
you
lodge
just have
there. Yeah.
Just pee it out later, okay? Bye.
Right. I mean, you'll burst. I don't know who thought that was a good idea. I'm sure that suppository does not get used a lot.
God. Jesus,
No, it can't.
Just the thought,
It can't.
literally, you're aroused for sex, and just the thought of putting a suppository kills the
That's
vibe.
it. I
do not want to have sex. Actually,
that was gonna be my next point. Like, how?
Wife, I will see you later.
Absolutely not. At that
Or
point,
husband, I will see you later.
Yeah, at that
Me
point,
as the woman, I'd be like, no, don't do anything.
Don't
Don't
do
touch it.
don't
Don't touch it.
don't do that to yourself. Please,
Are you
honey,
okay?
don't.
Are you happy?
Exactly. And then he comes out
How do
crying,
you feel?
but with a heart on. It's like, it hurts, but it's working. It's like, no.
Just fucking open your legs.
Oh my god. No,
Oh my god, I can't.
that was not a great invention in my opinion. Like, whatever. I mean, I don't know what need you must have for you to have to go down that route, but
okay, let me ask you something, because you and Mario are happily married for 9 years. Okay, just imagine yourselves 50 years down the line. Okay, Mario has some sort of degree of erectile dysfunction.
Right.
And he tells you, Jules, I'm gonna put the suppository.
I'll be like, we're done. We're done. No more.
I feel would you be comfortable with it, since you guys are dude, that's 59 years, almost 60 years.
My god. No, I don't. I just feel bad for him. It's not even about me. It's about him at that point. I'm just gonna hear him screaming in the bathroom, and then he comes out.
He's gonna bitch about it later.
Oh, fuck yeah. Of course he is. And then I'm gonna have to hear it. And it's I did this for you. No, you didn't.
No one put a gun to your head to
Nobody
stick something
did.
up your urethra.
Nobody did. And I sure as hell did not do that to you. I just stood outside. No. I'll ask him to go any other route but that one, to be honest.
Oh my god. Yeah, I know. I'm telling you, I was, reading about all these things, and I said, Jesus.
That's intense, man.
That's intense.
Yeah. No,
I will never look at erectile dysfunction the same ever again.
No,
I might just have a man just sit down and hold their hand. Do you really want to do this? Are you sure about this decision?
Oh my God.
No pressure.
Oh my God. Exactly.
I find you really attractive, but no pressure, okay?
Yeah. We don't need to do this.
We don't talk you off a ledge here. You don't need to do this.
Oh my god, yeah, it could become very dramatic very quickly.
Yeah.
That's for sure.
Oh my god.
Oh my god, okay, that's great. But anyway, all right, so then that's the other line.
Pills,
and then
injections, suppository. Then you have the vacuum device, which we kind of already touched on.
So I was gonna ask you, is that surgically inserted, or how does
No, it's an outside device.
Wait a minute, but then how is it getting the blood vacuumed to the penis?
No, so it literally goes over the penis, okay? And
it's like a tube.
Yeah, it's like a
clear
exactly.
tube. Okay.
Like a clear tube. It goes over the penis, and then they pump, so it draws blood into the penis. And then in order for them to keep it there, to keep that vacuum, they have to put the ring at the base, okay, to keep it there.
Oh my god.
Which is super painful.
Yeah.
But very portable. Very portable. Can you imagine, even as a woman that's dating, maybe men that are older and sees this situation a lot, she's like, "Are you having trouble, baby? Do you need a pump? I have it in my purse. I could just."
Oh my god. But I just how do you even still want to do have sex and do all of that? You gotta be very horny.
But it only lasts 30 minutes. So,
for you to go through all of that, you gotta want it, man.
Maybe not last 30 minutes, but
prime
time.
Yeah.
Prime time for the erection.
I can't. I can't even. Wow. Wow. Okay. All right. So there's that. That's like the non-invasive, whatever, I guess you could say.
And then there's
Drug-free.
exactly. Drug-free, portable, can take it with you anywhere.
No surgery needed. Like
exactly. You don't like the way that your erection came out, just it's okay. Just take it off, wait a couple minutes, do it again. It's like literally like a hickey.
Yeah, that makes sense. Like it just, oh my God. Okay.
It's a vacuum. It's a vacuum.
Oh, all right.
But anyways.
All right. Okay.
The other one is the actual like prosthesis.
Okay, so that's what you need surgery for. It's a whole thing.
Yes, it's a whole thing. So they basically insert the tube, right? I think it's like 2 tubes, okay? And then, listen, this is dedication. Okay? This is crazy dedication. There's the tube that gets inserted into your penis. Okay? There's a reservoir of liquid, okay, that goes into your abdomen. Okay? So like lower abdomen.
Okay. So kind of like a breast bag type of thing. So just like a bag.
Exactly. Like a bag.
Liquid.
Exactly.
Okay.
And
implant,
then
that's the word that I was looking for. Implant.
Yep, like an implant. It's literally an implant, like a implanted device that has water in it.
Okay.
And it's connected to a pump, which they casually place in the balls. Okay, or next to the balls. I should say scrotum. It's the scrotum. I'm a doctor. It's a scrotum.
So, hold on. So, so you're telling me that this prosthesis pretty much turns your scrotum, balls, whatever, into like a stress ball.
Yeah, I mean, I've never felt one before, but yeah. That is the idea. Is it the full execution like that? I'm not sure.
But I thought like...
I can't imagine that they're doing it like that though, because the testicles are very sensitive.
That's what I was going to say. Like
those are sensitive organs. So I'm sure they say it's in the scrotum though. So it's in the scrotum. So it's next to the testes.
Anyway, so you do that. You pump it up and it just goes up.
Yeah. So when you pump it, the liquid that's in the abdomen travels to the tubes that's in the penis, pushing it up, right?
Right.
Getting an erection. And then when you're done, you just release the valve in the testicles again.
And it goes back into the implant.
back down. Yeah. Like if nothing.
Wow.
Literally. An erection on demand.
Yeah. Yeah. Exactly. Like even if he's not into it, not thinking about sex, doesn't even care about it or whatever, it's there. It's there when you need it.
Exactly.
Damn, man. Like, I men are determined. They
take their sex very
seriously. There's no joking about it. Like, wow. Okay. This is, it went from just a pill, to full-on prostheses. Full-on
surgery, prosthetic device that you pump and you release.
Full-on. Like, what do you want? It's there,
It's do men, I would love to know what the process of this is. Like, do you need to take a test before to make sure, prove to me you know how to use this?
Right. Because it sounds like a complicated thing. It doesn't really sound like...
But it can't be that complicated.
Well, yeah.
Because I heard it's one of the most popular
prostheses
things to do now. You know what I mean?
Okay. Because
it works so well.
Yeah, I mean it has to. It's an erection on demand. Like you don't even have to sit there and think about something that turns you on.
No, baby, you want it, you got it.
Yeah, right now. Bam, 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 bam. Just pump it up.
Literally, pump it up.
Oh my God. Wow. Okay. Well, your YouTube, your history on your computer and all that's going to be very entertaining.
It's going to be great.
Yeah.
It's going to be great. I'll probably circle back and be like, hey, you know what I ended up learning about? This and this exists too. And mind blown.
Yeah. I mean, we're just here. I mean, this is a comedy show, so we're just here for the very basics of these things. We're not going into a deep dive TED talk on erectile dysfunction. This is just a topic for the episode today. So, I mean, you did a fantastic job describing it, I think. I mean, that was, I'm still in pain and mind blown about the suppository. I am still reeling in from that because I don't understand. And they say like, okay.
FYI, Mario, do not get the suppository if you want to get laid.
Do not. No. But like, I'm thinking because you know how they say that passing a kidney stone for men is like pretty much the equivalent of giving birth for women. So then you're just willy-nilly wanting to go through that by sticking a freaking suppository up in there. That's pretty much a kidney stone, you know?
Yeah.
So it's like, I don't know.
But it does melt. So it's not a stone, but it does melt.
But still getting it in there, it's intact until it goes in there. I mean, it's got to hurt for at least a minute. I can't. Like, I'm still reeling. I have a lot of mental images that they're not going to get out of my brain for a while now because I'm just like, you know that meme? I
just love the difference between your brain and my brain. Like, you're literally like, holy shit, Mario's never doing that ever. And I'm over here like, wow.
Yeah.
Amazing. Wow, that's so smart. Why didn't I think of that?
Yeah, and I'm here just thinking about the pain.
You're like traumatized and I'm over here like,
Yeah.
Wow,
yeah.
This could be these problems can be, resolved very quickly.
No. Yeah. I mean, I'm done. I'm done with that. I'm done with that train of thought. Because the more, it's like a white rabbit type of thing. I'm just going to keep going and following that train of thought, and it's just going to get weirder and weirder for me and more painful. So I'm done with that. But yeah, that's erectile dysfunction. That's our episode for this.
For our first episode. I thought that was...
Well, yeah, right.
Well, not technically our first episode, but our first medical episode.
So this is like what to expect moving forward.
Exactly.
This is a good...
It's not anything crazy specific.
Absolutely.
It's just a broad topic.
Yeah, we're touching upon like interesting things about that topic.
Exactly.
Not everything that there is out there, because obviously it won't be an hour long at that point.
Exactly.
It'll be like several parts to erectile dysfunction, and we're not going to do that.
However, if you guys want a part 2, maybe we can get a urologist into this.
Yeah.
Or something, and answer some questions like FAQs.
Exactly.
But again, if you have any questions, you go to your doctor. Do not come back to this podcast.
Yeah, not the place for it. Go to your doctor. Call your insurance company. They'll direct you the correct route, whatever. And ZocDoc out there, if you want to sponsor us, go ahead. That's another website that I know you can find doctors in.
Hi, we're Funny Medicine. You'll love us.
So yeah, that's pretty much it. Go ahead and check our TikToks out. Evie's right now still in her scrubs because she's a badass and she came from work straight.
You can look at our IG.
Yeah.
You'll see me
in her scrubs, in her green scrubs.
I woke up early today. I already did my rounds, already got some patients. I need to respond to some text messages now.
Yeah. So, she's a badass.
You'll see us in the real life.
Yes.
Live.
Exactly.
Live from my laundry room.
That's true. We didn't say that.
Oh, we did it?
I don't think we did.
Oh, yeah. We're in our laundry room, guys.
Well, laundry.
Mine.
Your laundry room, which is still like getting installed and whatnot. So we tried like...
No washer dryer. The literal thing that you need for a laundry room. But it will happen. It will eventually happen.
Well, your house looks awesome.
Thank you. I can't wait to finally move in.
I know. But like, it's you're doing great. It's awesome. And maybe we have like more podcast recordings here and whatnot.
From the laundry room.
Yeah.
From those that are hearing us from the get-go.
Exactly.
You'll know.
Yeah. You'll know. You will know. Because you're going to hear it, like how it sounds like, we are in an empty-ish room. So we're trying, guys. We're trying. So anyway,
Thanks for listening to our show.
Thanks for listening, and we'll catch you on the next one.
Happy Zaddy's Day.
To all you zaddies out there. Bye.
Bye.
Like, comment, review us on all streaming platforms, Spotify, Apple Music, Amazon Music, etc.
Check us out on Instagram and TikTok at Funny Medicine Podcast. Our Gmail is funnymedicine305@gmail.com. And remember, we are not diagnosing you.
Definitely not. Just funny stuff.
See you later, guys.